Hi, my name is Ileana Massey, and my group members are Barbara Hormanu, William Kirkman, Marie Spain, and Patrick Waddell, and our disease investigation is on epilepsy. Epilepsy is a group of uncontrolled cerebral discharges that recurs at random intervals. The seizures associated are a form of convulsion. Once referred to as the sacred disease, the word epilepsy is derived from the Greek word epilepsia, which means to take hold of or to seize. The oldest detailed account of epilepsy is on a Babylon tablet in the British Museum. The tablet emphasizes the supernatural nature of epilepsy, with each seizure type associated with the name of a spirit of God, usually evil. Treatment was therefore largely a spiritual matter. During the last few decades, greater attention has been paid to the psychological and social needs and quality of life issues of people with epilepsy. Congress first authorized funding for the CDC epilepsy program in 1994 with the recognition that the public health initiatives were needed to help improve the lives of people with epilepsy. Soon thereafter, in 1997, CDC sponsored the first national conference on public health and epilepsy. National prevalence. The underlying risk of developing epilepsy is 1%. By age 20, 1% of the population can be expected to have developed epilepsy. By age 75, 3% of the population is expected to have been diagnosed with epilepsy. 3 million people are affected by epilepsy and seizures. National incidence. 1 in 26 people will develop epilepsy sometime in their life. Incidence is highest under the age of 2 and over the age of 65. Incidence is greater in African Americans and socially disadvantaged populations. Remission statistics. Remission for epilepsy is being free from seizures while on medication for 5 or more years. 70% of people with epilepsy can be expected to enter remission. 75% of people who are seizure-free on medication for 2 to 5 years can be successfully withdrawn from medication. At this time, there is no available statistics for North Carolina. Etiology. Most cases of epilepsy are idiopathic, but may be due to inheritance. Other causes are brain trauma, severe blow to the head, brain tumor, a stroke that restricts oxygen from the brain infections, a penetrating head wound, and alcoholism. Types of seizures. There are multiple types of seizures, but the most common type is tonic-clonic. It lasts up to 3 minutes with a long recovery. The person may lose consciousness, the muscles stiffen, and jerky movements occur. If the seizure lasts for more than 5 minutes, then medical emergency occurs. Some conditions that may lead to epilepsy are sleep deprivation, alcohol or drug use, stress, and eating specific foods.
Risk factors and complications. Risks include age, family history, and head injury. Complications. Having a seizure at certain times can lead to circumstances that are dangerous to yourself or others. Others include falling and drowning. Serious complications include status epilepticus. This condition occurs if you're in a state of continuous seizure activity lasting more than 5 minutes. Sudden unexplained death in epilepsy. The cause is unknown, but some research shows it may occur due to heart or respiratory conditions. Diagnostic procedures include an EKG, X-rays, CT scan, and an MRI. There is no cure for epilepsy, but there are different ways to treat and manage seizures, such as medication, brain surgery, and preventing of self-injury. Current public health strategies include educating family and friends on epilepsy and following the treatment plan. The Healthy People 2020 objective is to increase the proportion of people with epilepsy and uncontrolled seizures who receive appropriate medical care.